We're in opposition of Measure 109. And in fact, we recently had several other major organizations join our opposition. The Oregon Medical Association recently joined our opposition. They're also in opposition of Measure 109. The American Psychiatric Association is in opposition of Measure 109. The Oregon Association of Child and Adolescent Psychiatrists is in opposition, as well as the American Academy of Child and Adolescent Psychiatrists. Together, that makes up about 50,000 medical professionals, healthcare professionals that are opposing Measure 109. So there's 3 stages of the FDA approval process. Currently, psilocybin is in the earlier stages. So there's phase 1 and some early phase 2 trials. And so it's such early stages of research that we have no idea what it could happen, what could cause, if it's going to interact with other medication or other medical conditions. So it's really in its infancy in terms of development and studying. The side effects could involve anxiety that can last for weeks or months, or persistent flashbacks from hallucinations, nausea and vomiting, changes in blood pressure, and the induction of hallucinations itself, given to the wrong patient that's not carefully screened, could actually worsen the course of psychiatric illness. It's written in the measure that the Oregon Health Authority, who will be helping set up this program, may not require a psilocybin service facilitator, that's the person who's going to be treating the patient, giving them psilocybin, to have a degree from a university, college, post-secondary institution, or other higher institution of higher education. So that means that they're not letting OHA even mandate that this person is any healthcare provider or any mental health provider.
Is that something that often happens, where the Oregon Health Authority is given a measure that's been passed and basically told, you figure out how to implement this?
We don't know any examples of where it's ever happened, and a 2-year time period where they're essentially acting like the FDA was really unrealistic. They don't have the resources for that or the expertise for that. So we do not think that this is a good setup for the OHA to be using their resources, and I don't think they're capable of that in a 2-year period.
As long as you're an adult who is told the risks ahead of time, what's the harm in letting them make their own decision to partake in this kind of therapy?
So that's a great question. That's exactly why we're concerned. So there haven't been enough data to even tell an adult what the risks are. This has not been studied to the degree of the phase 3 trials where you actually go and look at the risks. You look at the risk of psilocybin mixed with an antidepressant, or you look at the risk of psilocybin in a woman who is on hormone replacement therapy, or a male who has a history of bipolar disorder. Those risks have not even been studied yet. So there's no way that we could tell people what the possible risks are. Not to mention, it is not even a healthcare provider that would be telling them those risks. So that would be not a fair comment. They're not getting informed consent to make that decision for themselves. One of our concerns is there are so few restrictions on the measure. So in one part of the statement, it says that you don't even need a medical diagnosis to receive psilocybin treatment. In some ways, these are setting up dispensaries and not medical facilities to facilitate psilocybin treatment before it's FDA approved. This measure does not require a prescription, as I mentioned, does not require that you're in a medical facility or that it's administered by either a mental health professional or a medical professional. So that is what we are concerned about, that if we really were going to medicalize psilocybin, we would wait for the FDA and we would have medical or mental health providers who are the ones that are actually treating mental health in Oregon. We would have them be facilitating this, quote, new tool for helping people with their mental health in Oregon. We are still several years out from having enough data that would support our use of psilocybin for patients with psychiatric illness. I think one of the positive things is there are a bunch of studies currently underway, about, I think, almost 40 that I saw. So we're really moving in the right direction. There's people that are looking at different medical conditions and psychiatric conditions, and potentially we're going to be looking at side effects, but those need to be finished, peer reviewed, so that they can publish and then submitted to a regulation body that actually looks at the scientific rigor of these studies. So then we can move forward. And once that occurs, you will not need a separate facility to administer psilocybin. It would be able to be given by doctors and nurses that would be prescribing other medications, and those that prescribe other medications all the time.